If you're getting ready for a frozen embryo transfer, you probably have a ton of questions. We just transferred this lovely little embryo a few days ago, and I've been getting a whole bunch of questions from friends and family about how many embryos did we transfer, is it a boy or a girl, and most importantly, when can we find out if we're pregnant? So today we're going to answer all of those questions, and I'm just going to go over for us what the process of embryo transfer was like. If you're new, my name is Jess. I'm a certified nurse midwife and infertility mom. I conceived my daughter Ingrid after 3 rounds of IUI, or intrauterine insemination. And earlier this year, after several rounds of IUI that didn't work and an ectopic pregnancy, we decided to move to IVF to conceive our next child. I did egg retrieval at the end of July, and there was a delay between egg retrieval and embryo transfer because we opted to do pre-implantation genetic testing, or rather testing of our embryos to make sure they were normal, just because we've had 2 miscarriages in the past. The genetic screening process took a few weeks. They took cells from each of our embryos to make sure they were normal. We had 10 embryos to start with, and after the genetic screening process, we learned that only 6 of them were genetically normal. They do check the sex of the embryos when they do the genetic screening, and when they called us with results, they offered to tell us the sex of the embryos, and we said no for a couple of reasons. First, you just never know if an IVF round is going to be successful when they transfer an embryo, and I personally thought it would be more painful if I knew the sex of the embryo if the transfer wasn't successful. And then second, I had a lot of complications with my placenta after the birth of my daughter, and I actually almost had a hysterectomy. So God forbid if something like that were to happen with another pregnancy, if I lost my uterus and there were embryos that we didn't get to use, I just didn't want to know the sex of those embryos that were remaining. When you do IVF, they grade each embryo on a scale, and so we just asked them to pick the best quality embryo that we had. When they created our embryos, they used a process called ICSI, which stands for Intracytoplasmic Sperm Injection, and that's where instead of just putting an egg in a petri dish with a bunch of sperm to self-fertilize, they will actually just take a single sperm and inject it directly into the egg, and they will most commonly do this if you have some male factor infertility. For our office, anytime they do ICSI, they also do what's called assisted hatching, where after the embryo has developed, they make a hole in the outer layer so the embryo can hatch and develop and grow. And when they do this, it does slightly increase the risk of that embryo later dividing into 2 babies or into twins. And so they only transferred 1 embryo just because we are already going to be at an increased risk of twins. And so if they had transferred 2 embryos, we'd be at an increased risk for triplets or even quadruplets. And that's really not what we're going for. On transfer day, the clinic asked me to arrive 30 minutes early to my appointment, and I'm assuming this is just so they know that I'm there and they can start thawing my embryo. When they thaw an embryo, they want to make sure first that the embryo has survived the thaw, but then they also want to make sure that it has started growing and expanding again. About 30% of embryos won't survive the thaw, so for our office, they told us if our embryo didn't survive, they would have thawed another embryo for us. They also told me to arrive with an empty bladder, like to pee before I left the house, and then bring a water bottle so I could drink water while I was waiting, because they do want you to have a full bladder, just because the uterus sits on top of the bladder, so then if your bladder is full, it just makes it easier for them to get the catheter into your uterus to transfer the embryo. So when it was time, they took me back to the operating room area, and I was actually in the same pre-op holding room that I was in before I had my egg retrieval. The nurse, the embryologist, and my reproductive endocrinologist were all in the room. They all checked my name, my date of birth, my husband's name, and date of birth, just to make sure that, yes, they have the right embryo with the right person. They do have you undress from the waist down, put your feet in stirrups, and place a speculum, so that's not the most comfortable thing in the world, but it's kind of cool because the nurse is holding the ultrasound probe over your belly, so you can kind of watch what's happening inside your uterus and honestly inside your vagina too. So I thought that was fascinating as a healthcare provider. And then they place the catheter into your uterus under ultrasound guidance just so they know they've got it in the right spot. Then once that's ready, the embryologist brings in the embryo, and the reproductive endocrinologist sucks it up into the catheter and shoots it into the uterus. And it's actually really cool. It looked like a flash of light on the ultrasound screen when they put the embryo into my uterus. And they let me take a video of that, which I will try to get into this video. Once the embryo is in, they withdraw the catheter, and the embryologist actually takes it back into the lab to look at it under microscope, just because occasionally an embryo can get stuck in the tube, and they want to be 100% sure that that embryo made it into your uterus. So it takes a couple of minutes while the embryologist is looking at that catheter under the microscope to make sure the embryo is out, but then she just shouted, all clear, and the reproductive endocrinologist was able to take the speculum out and cover me back up. So the speculum was in for probably 5 to 7 minutes, so longer than a pap smear, but really overall, for me at least, it was a very painless process. The catheter insertion didn't hurt, the embryo transfer didn't hurt. It was just uncomfortable to have the speculum in. Next, they just had me lay down, and they kept the room dark. They did put the video of the embryo going into my uterus on a loop for me to watch, which I thought was kind of nice, but they just had me stay laying down for 15 minutes before I could get up and empty my extremely full bladder. And then I literally got on a plane right after. I called a Lyft to the office and went straight to the airport, and 2 hours later I flew home. So it's not like you have to be on strict bed rest. They do advise resting and taking it easy, but my nurse also told me, research doesn't show that really helps at all. So it's up to you how vigorous you want to be, but they do say no vigorous exercise, take it easy as much as you can. Unfortunately, we travel all the time, and so getting to go through the airport without a toddler is actually very relaxing, and I can just take my time and get a salad and read my book, and that was a very relaxing experience for me afterwards. The next step will be a pregnancy test, so blood work on October 16th, so about 11 days after transfer, to confirm if I am pregnant or not. And since everyone already knows what's going on inside my uterus, I do not plan on being secretive about it, and I will let you guys know as soon as I know anything. If you found this video helpful, please like, subscribe, and turn on the notification bell. I post new videos every week about infertility, recurrent pregnancy loss, and soon, pregnancy after 35. Next week, I'm going to talk about all of the evidence-based things you can do to increase your odds of a successful embryo transfer. Thank you so much for watching, and thank you so much for all of your support. If you have questions about embryo transfer that I didn't answer in this video, please leave them in the comments. Thanks.